This week is on all hazards preparedness. What we're going to do this week is take a look at the PAPA Act. It actually stands for the Pandemic and All Hazards Preparedness Act. We're going to talk about the main components of the Act and their purposes that they serve in public health preparedness. And then from there, we're going to go into the core capabilities, both the national capabilities and the public health preparedness capabilities. And lastly, we're going to talk a little bit about a risk assessment. So these all build into all hazards preparedness. So the Pandemic and All Hazards Preparedness Act of 2006 was intended to improve the nation's health and medical preparedness and response capabilities, whether deliberate, accidental, or natural. Through this legislation, a new position within the Department of Health and Human Services was created. This new position is called the Assistant Secretary for Preparedness and Response, or ASPR. This position really focuses on building medical capabilities, countermeasure research, grants to strengthen the capabilities of hospitals and healthcare and public health emergencies, and it provides support for the national programs to the state and locals to enhance their capabilities. So all of these things are overseen by this new position. The Biomedical Advanced Research and Development Authority, BARDA, and medical countermeasures is one of the first components of this. BARDA ensures the funding and support for the development and the procurement of drugs, vaccines, and other medical countermeasures needed to respond to chemical, biological, radiological, or nuclear incidents that originate from either accidents or terrorist events or emerging infectious diseases. Another component of the All Hazards Act is to have its emergency support function number 8, and that function is entitled Public Health and Medical Response, and this is for domestic programs. The textbook went over the emergency support functions, which are how federal and state governments organize their resources and capabilities. These federal assistance then can be deployed to state, tribal, and local officials. The public health and medical services provide for disaster medical needs related to mental health and behavioral health, substance abuse, and those at risk and those that have functional needs, and it also provides for veterinary and animal health issues. More specifically, this provides assistance with some of the following: assessment of needs, both public health and medical needs. It helps with health surveillance, and these are at the time of a response, that a response happens. Medical care, health, medical, and veterinary equipment and supplies. It helps with patient evacuation, direct patient care. It also enables communities to get blood and blood products, food safety and security, ag safety and security of drugs, biologics, and medical devices. It provides for behavior health care, public health and medical information. It helps with vector control, potable water, wastewater disposal, mass fatality management, and veterinary medical support. So how does this all come about? We know that this comes from the feds and is brought down to the state and the local areas. But what federal agencies are really responsible for providing this to states and locals? One of the first ones is the Department of Defense, and the Department of Defense has helped out with transporting patients. It could be either evacuation of hospitals or evacuating communities. Department of Agriculture deals with matters that are related to animal disease and food safety. Department of Energy provides resources for monitoring and decontamination of radiologicals. Department of Justice provides for victim identification. Department of Labor works with the communities on the responder health and safety of the responders. Also, part of this support comes from the National Disaster Medical System. And the National Disaster Medical System consists of several federal teams. One of them is a disaster medical assistant team, which I'm sure you've probably heard of. They have personnel, supplies, and equipment, and usually when they're deployed, they have enough for at least 72 hours. And there's several thousand people that work on those assistance teams. The National Medical Response Teams, who provide care to victims of weapons of mass destruction. There's also a Disaster Mortuary Operational Response Team, and this team provides victim identification and then mortuary services. There's a lot that goes with that. They also have to know cultural competence. They have to know again, dealing with families and the whole extent of mass fatalities. There's a Family Assistance Center team, which works with disaster mortuaries. They work with the American Red Cross and others to collect victim information and work with families. There's something called the National Nurse Response Team that gives support to patient care. The National Veterinary Response Team, I'm sure that some of you have heard of this. They come in and do assessment of needs. They can do treatment of animals, disease surveillance, animal decontamination, just to name a few things. The National Pharmacy Response Team, they provide mass prophylaxis or mass vaccination. There's a mental health team that comes in and does counseling and other assistance to some of the other teams, the disaster medical assistance teams and the mortuary teams. There's the Strategic National Stockpile, and the Strategic National Stockpile has medical supplies and pharmaceuticals, antidotes. All of that is on board and can be deployed and delivered within 12 hours. There's another side of the emergency support functions in which they focus on international programs, and this is so that there are better mechanisms for working with the World Health Organization regarding public health events that could become public emergencies. They participate in internationally focused exercises and trainings. They review lessons learned from events such as Hurricane Katrina and Hurricane Rita to see what can be applied to international events. Another component that falls out of the PAPA Act are grants. And these grants focus on, there was extra money that was allocated for pandemic preparedness plans, and that was filtered down to states and to the locals. There is a program called the Preparedness Emergency Response Learning Centers, and they develop trainings for local public health, state public health, all kinds of traditional and non-traditional public health workers. We're actually one of those centers. There are 14 centers that have been funded across the nation. There are also new grant opportunities for real-time disease detection, healthcare facility partnerships, and situational awareness. So there's lots of money that's related back to the PAPA Act. Another component of this act is really focusing on at-risk individuals. And at-risk individuals includes individuals that have additional needs in communication, medical care, maintaining those that are trying to maintain independence, supervision, and transportation. In addition, it recognizes those individuals that have disabilities, that live in institutions, and again, there are less and less that are living in institutions. They're being released from institutions into group homes and other supervised living environments. It could be individuals that are from diverse cultures. It could be individuals that have limited English or non-English speaking. It could be individuals with transportation disadvantage. with chronic medical disorders or pharmacological dependencies. So to further define these individuals, we break those down into functional needs. And those functional needs are communication, medical care, independence, supervision, and transportation, as we had listed above and talked about above. Communication may mean that they may have limited receiving and responding, limited abilities to receive and respond to information. They may have hearing, vision, speech, cognitive, or intellectual limitations, or even, as we discussed earlier, limited English proficiency. Information needs to be in a format for those individuals in which and at a level in which they can respond to, they can process and respond to. So communication is a huge issue for these individuals. Medical care is another component. Medical care is another component. They may need medical care from healthcare providers for contagious diseases, terminal conditions. They may need wound care. They may have a feeding tube, need oxygen. They may need dialysis or life support. So it's something that's already going on with that individual that they need medical care for. Under the topic of independence, this relates back to that individual needing some type of support to accomplish daily living activities independently. And this includes such things as the ability to have a walker, to have wheelchairs. Maybe it's an infant and they need formula, diapers, or some type of ostomy supplies. So it's pretty wide range, but it's something that individuals need to be able to complete their daily living activities. Under the topic of supervision, this includes individuals that may need daily supervision. So it could be individuals that have Alzheimer's or that have schizophrenia, could be individuals that have intense anxiety. It also includes the group of the younger individuals that couldn't take care of themselves if they were separated from their parents or their family or caregivers. Transportation is also a huge issue for those at risk. For those that cannot drive or they don't have access to a vehicle, they need to know how to access transportation. And again, it needs to be communicated in a way where they can process that and actually access transportation. So at-risk individuals really became a focus of the PAPA Act. Again, the PAPA Act was signed into law in 2006, and that was after looking at what happened with Hurricane Katrina and having those individuals that were at risk falling through the crack, and a lot of fatalities within that group subpopulation. Another component of the PAPA Act is the National Health Security Strategy. It's a comprehensive strategy that focuses on strategic objectives and operational capabilities that are necessary for protecting people's health in a large-scale incident. It includes such things as disease outbreaks, biological, chemical, and radiological agents, and other public health emergencies. The focus of these objectives are on the following. The focus is to empower individuals and communities. It's to develop and maintain a workforce that can respond. It focuses on scalable healthcare delivery, and that means as the impact increases and more people are infected, that you have the surge capacity to deal with their healthcare needs. Another objective is timely and effective communication. It also includes developing a countermeasures enterprise, and again, that's an enterprise that deals with the vaccinations and the prophylactics. It has an objective on prevent and mitigate emerging threats, including environmental threats. It also has an objective focused on post-incident health recovery, and this can be a long-term recovery. It also includes working with global partners, ensuring that all is built on the best science, evaluation, and quality improvement methods. Situational awareness includes surveillance, credentialing, and telehealth. It focuses on improving information technology and information management so that these systems can become faster, can become more efficient and higher quality detection to respond, recover from emergencies quicker. And some of those systems the book is covered, but they include Public Health Information Network, BioSense, the nation's electronic disease surveillance system, epidemic information exchange, and resource and patient management system. And a lot of these have already been in place for many years, but it's just trying to, again, economize, make them faster, and able to respond to larger emergencies. The last component is education and training, and education and training is focused on providing programs for first responders and healthcare professionals working with at-risk individuals. It also focuses on those core competencies, public health response competencies that we talked about at the beginning of the course. It talks about those competencies, developing a framework then for foundational public health preparedness training. So there are several components with the PAPA Act that, again, consider all hazard approach to preparedness and response. Out of building from the PAPA Act, we look now at the core capabilities because we know that we have to have a framework for responding and building upon all of those components that PAPA has set forth. So with that, there was a set of national core capabilities that were developed, and there are 31 individual capabilities, and this is national capabilities. Some of those include planning, public information and warning, operational coordination. There's one on cybersecurity, supply chain integrity and security, critical transportation. There's one on fatality management. So again, these kind of pair up the essential support functions really do pair up with these core capabilities. And a complete list and more information are located on FEMA's website. You just need to type in core capabilities and you'll come up with a complete list of those. In addition to the national capabilities, CDC has prepared, by working with partners, CDC has also prepared a set of 15 core public health preparedness capabilities. These were first designed to improve public health response by creating a more effective system. It assists both state and local public health planners to prioritize how they're going to better prepare and allocate federal dollars. These capabilities are known now as a national standard for state and local planning. The 15 capabilities are categorized under 6 different domains, and those domains are biosurveillance, community resilience, countermeasures and mitigation, incident management, information management, and surge management. Biosurveillance includes such capabilities as public health lab testing, public health surveillance, and epi investigation. Community resilience focuses on the capability of community preparedness and community recovery. Countermeasures and mitigation focus on medical countermeasure dispensing, medical material management and distribution, non-pharmaceutical interventions, and responder safety and health. Incident management focuses on emergency operations coordination. Information management focuses on emergency public information and warning and information sharing. And then surge management focuses on fatality management, mass care, medical surge, and volunteer management. So as the incident grows, it's really focusing on the surge capacity in many different areas. These capabilities were created by reviewing the PAPA Act, Homeland Security Directives 5, 8, and 21, the National Health Security Strategy, and other documents from ASTO and NATO, It also involved engaging a variety of national stakeholders like the Department of Transportation, Health and Human Services, of course, the Assistant Secretary for Preparedness and Response, the American Hospital Association, and the National Emergency Management Association. They were to be well-rounded capabilities. Each capability then is defined by a function and performance measures, task and resource considerations. So we're not going to go through every one of them, but I just want to give you a snippet of what one of these capabilities looks like. So let's look at the fatality management capability, and that's capability number 5. Each one of these capabilities, when you go into it, is defined. Capability 5 is defined as coordination with other organizations to ensure that there's proper recovery, handling, identification, tracking, storage, and disposal of human remains and personal effects. It's also to certify the cause of death and facilitate access to mental health and behavioral health services for family members, responders, and survivors. So each capability is defined, and then on top of that, they break that down into the functions, the main functions for each one of these capabilities. Each function then is broken down further by what tasks need to be complete in order to meet that particular capability. So public health has their own set of capabilities, and so does healthcare. Healthcare has a set of capabilities, and their capabilities are, again, similar to public health, but they are combined in the planning purposes at the local level. Public health and healthcare work together and bring their capabilities, each set of capabilities, together to have joint capabilities and help improve the public health system and the healthcare delivery. So, for instance, under Capability 5, fatality management, one measure could be how they can support family assistance centers that are set up during a mass fatality. This then needs to be written or documented into their plans so that there's evidence for completing those capabilities. These are new directions for both public health and healthcare. It's really bringing primary care together more closely with public health, and it's about forming these healthcare coalitions. Public health and healthcare activities are really in direct support of the PAPA Act. They help to strengthen, as I said, public health and the healthcare systems so that we can improve on our response efforts. So we've heard about capabilities and lots of different sets of capabilities that support the PAPA Act. But before communities start working on their capabilities, they really need to conduct a risk assessment. And in Iowa, our local health departments conducted a risk assessment and had to have it completed by February of 2013. The risk assessment, again, really helps communities plan for the hazards, the risks, and the threats that are really most likely there to impact their community. So there are several tools that are available out there for them to do that. We've created one through our Upper Midwest Preparedness and Response Learning Center. We created one for public health and one for healthcare. And I just want to give you kind of a taste of it. There's also a website under additional resources. If you want to go in and look at the tool, you can do that. But the tool is really based on the 3 types of hazards. We classified them under natural disasters, human, and technological. And again, the natural disasters are as you see, are floods and tornadoes, storms. They can be anywhere from extreme temperatures to wildfires to landslides. The human cause, another type of disaster that we classified these under, are called human cause hazards. We talked about this a little bit at the beginning of the class, or the beginning week of the class, and they include anything that are from mass casualty, active shooters, terrorism acts, bomb threats, etc. And the last category that we've developed or had organized our disasters under technological and accidental hazards. And again, those are radiological events. They could be electrical fires. They could be hazardous materials, and the list goes on. So within the risk assessment tool for local public health, the hazards have a set or a series of 7 questions. And there's only one person for each one of the health departments that goes through it and fills out this risk assessment tool for their organization. And the 7 questions have to do with human impact. It has to do with public health infrastructure, community impact, training, and preparedness. So the probability focuses on how likely it is for this particular hazard to happen in my community. And it's on a Likert scale, so it's there's no chance that this will occur, and then it goes on up to that it's highly likely to occur. There's also a question that focuses on human impact and how would you assess your agency's current abilities to respond to the possibility of death or injury. And again, it's no impact to high impact. They ask a question on public health infrastructure. How would you assess your agency's abilities to respond to possible loss or damages? And again, it's on a scale from no impact to high impact. Community impact. How would you assess your agency's current abilities to coordinate with other agencies and secure community resources? And it's on a scale from no way to prepare ahead of time for the event, no evacuations necessary, to little or no mitigation activities have been completed and substantial work needs to be done on that area. There's a training question that focuses on how would you assess your agency's current abilities in the staff competency to respond to no way to train staff ahead of time, workforce is properly trained for the event, to considerable training is needed. So again, it's on a scale. And lastly, there's a preparedness question on how would you assess your facility's current abilities in pre-planning for this event. And it is from no way to prepare ahead of time to then being prepared. So at the end, after they're done answering the questions and completing the questionnaire, they'll get a report out and they'll have an overall score for each one of the hazards. The higher score means that it should be considered a hazard in their community, and they decide as to how many of those hazards they're going to build in when they look in their at their planning and capabilities and work on those lists. So this kind of was a tedious week of going through a lot of the things that are in effect for all hazards planning. But again, it gives you the wide range of what's going on from the national level and how that trickles down to the state and the local level in being prepared for all hazards. It's really, again, the turn of events that have happened from Hurricane Katrina to developing the legislation out of those lessons learned from Hurricane Katrina, putting into effect legislation for an all hazards approach, breaking that down so that at the national level we're more prepared. We can again work with individuals that are at risk. We can have all of the appropriate things ready to respond to a national disaster and to give emergency support for public health and health care in times of need so that they can respond and deploy equipment and supplies and personnel to take care of events at any time. So hopefully this has been able to give you a better picture of what all hazards approach is and how it's applied into plans in developing the capabilities in a needed response. It really, again, provides, I know we've said this several times, but it does provide a framework for local public health and healthcare to work together and to become as responsive as possible in preparedness. Thank you for listening to this presentation.